Petrov, a lot of you will have heard of, is a cardiologist who's based in Sofia in Bulgaria. It was Dr. Petrov's friendship and association with Mr. Donald Reid that helped us hugely to get things moving in the UK. Donald attended a few sessions over there and came back increasingly enthusiastic, I think it would be fair to say. And we had the pleasure of having Ivo in Edinburgh to assist us with the first two cases on Thursday. And you know, the word that kept coming up was amazing. Everything was amazing. And I think Ivo's enthusiasm in this area and his expertise was very much appreciated. So he was going to talk through some of the Bulgarian experience, which along with the experience of man in Poland is the most extensive in the world, and we're delighted to have you. Ivo.
Dear colleagues and friends, it's my real pleasure and honor to be here. It's really exciting to assist such a big event that is a huge step forward in treating this really very bad disease. I want to thank Tom about the invitation and yeah, good luck. I'm going to talk more by endovascular point of view. The lecture of Professor Kaki was fantastic, really. It was one of the most beautiful examples how the things can be presented by scientific point of view. And in fact, this is support very much us to go forward. We started, okay, a couple of words about my country, Bulgaria, in white over there in the Southeast Europe. It's a small country in the Balkan Peninsula, just above Greece. A couple of pictures from the seaside, the Black Sea and Tower Mountains also. Very beautiful. We have nice beaches in the summer and good ski resorts in the winter. And this is the Japanese hospital in Sofia I'm belonging to. The Japanese hospital is quite a big hospital, 900 beds with all the specialties. And we, with Professor Gruzinski, we are coming from the cardiology and angiology department. We joined our efforts in treating patients with all kinds of vascular pathology, coronary, so cardiology and non-coronary. The multiple sclerosis is absolutely well shown. That is the most common chronic disabling disease of the central nervous system in young adults. The estimated prevalence worldwide is about 2 million people, and the incidence is quite variable. It's from 5 to 30 person per 100 population, and it's really variable by climate zones and by geographical zones on the globe. But it's very characteristic that the more cold countries are more affected by the disease, as shown in this map. The clinical course of the disease is variable. It usually starts with reversible episodes of neurological disability in the third or fourth decade of life and transforms into a disease of progressive and irreversible neurological decline in most of the cases by the 6th and 7th decade. It's characterized by dissemination in space and time, and Professor Kaki showed much more interesting pictures about the dissemination of disease in space. And what about the CCSVI as a reason to develop the MS? The CCSVI, you saw that the Venus theory had his basis from studies 100 years ago. But now with the pioneering works of Dr. Zamboni, all these findings are joined in a theory, in a combined theory. This is the pioneering work of Dr. Zamboni, that they have shown that the CCSVI is a syndrome characterized by impaired venous drainage of the membrane and the spinal cord due to obstruction in the internal jugular veins of vertebral or azygos vein, leading to development of extensive venous collaterals to compensate the venous drainage. But as we have shown in many our patients, the pathology is involving also the small branches of these main truncular veins, not only the big veins. The impaired venous outflow leads to reflux, as Mark has shown, of venous blood, venous congestion, and increase of the venous pressure in the membrane and the spinal cord, which in turn, combining with other possible harmful agents, damages the blood-cerebral barrier, resulting in microhemorrhages and activation of the immunity. So the disease is multifactorial, as you know, but maybe in the basis of the disease is the venous insufficiency and venous congestion. Here are shown the microextravasation in case of CCSVI. As you see, the conjunction between the cells are disrupted, and this microextravasation causing the broken blood-brain barrier that is one of the strongest barriers in the human body. This blockage is in fact sensitizing our immune system against our proper proteins into the brain, and this is the mechanism to have the autoimmune reaction. So what is the basis of the interventional treatment of the veins in the CCSVI conditions? The basis is that we have obstruction of the internal jugular and the azygos vein. We have increased venous pressure that we have to decrease with the treatment. We have to close the blood-cerebral barrier and to stop this damage. Probably the inflammation is also decreasing with the treatment, and maybe stopping the demyelinization process. That is causing, in fact, neurologic improvement. This is the well-known scheme of Dr. Zamboni, the patterns of different patterns of the venous insufficiency involving both jugular, one jugular and the azygos, and all the three truncular veins. The study of Dr. Zamboni showed that if we use all his criteria, 5 main criteria of venous insufficiency in the Doppler investigation, we can find practically 100% of the patients with multiple sclerosis some venous pathology of different type. There are also other studies. One of the biggest was done in Buffalo by Dr. Zivadinov, showing also that the prevalence of CCSVI is bigger in MS patients than in the general population. There are also studies by Dr. Simka, Dr. Alomari, showing a percentage very close to 100% involving the vein pathology in the MS patients. Of course, there are also other studies, not so positive, but they are using other criteria and other methodology. It's very much related to what Mark has said, that we have to impose standards and one and the same methodology in order to register the cases, first the diagnostic cases and secondly the treated cases that are done on the same way in order to rely on the same results. So to pose on a scientific basis everything.